She wouldn't eat. She would clamp her jaws down and make faces at us. As soon as she would see a spoon, she would scream. She began crying all the time. We didn't know what to do with her. It was very frustrating.
Holly Viscusi says her daughter Becky was unhappy, in pain, and not gaining weight.
The crying went on.
She took Becky to a number of doctors. Some said it was acid reflux, others said she'd outgrow it. No one with a solid answer. Despite the fact she too is a doctor, Becky's mom felt like no one was listening.
I knew something was wrong.
After doing a lot of digging and research, Becky's mom found Dr. Fischer.
So this was a mom who had intuition, and she was extraordinarily observant and very close to her child, and really described this impeccably. And it wasn't a classic reflex history.
Dr. Fischer quickly diagnosed the problem.
I just think people just kind of made a quick decision. You know, everyone's seeing a lot of patients probably and didn't think, gosh, could this be the zebra in the room, the aberrant artery that can happen and flow behind the esophagus. That means an artery that it goes behind the esophagus, which is how you swallow. And by doing that, it indents or pushes back on the esophagus. So it's hard to swallow, and you're swallowing almost against a string behind it. So it hurts.
An artery wasn't in the right place, and it caused pain when Becky swallowed. It was difficult, and I felt Dr. Fischer was the first one who listened to us.
And at 18 months old, Becky had surgery. So how'd it go?
We came home and there was pizza on, cold pizza on our counter that our son had left. It was leftover, and we cut it and slice in half, and Becky ate a half slice of pizza.
And ate Doritos.
Like it was like break out the champagne here.
She immediately was eating like a champ.
The issue was fixed. Becky grew up with a normal life, even becoming a wonderful musician. But at 16, another issue. A mass was found on Becky's abdomen. Now, for the first surgery, Dr. Fischer was at Johns Hopkins, but now she's the chief of pediatric surgery at Palm Beach Children's Medical, based out of West Palm Beach, Florida. And though Becky and her mom were still in the Northeast, they weren't taking any chances with this newfound mass.
I was worried because I was like, I just didn't want it to cause future problems.
I immediately thought, you know what, the only one I trust who's always guided us properly was Dr. Fischer. So we knew she was in West Palm, so we gave her a call. What do you think?
I didn't want it to potentially grow larger in size, and I didn't want it to maybe hurt something inside of me, or just rupture or something.
But if we allow it to get bigger, that might be a bigger problem.
And she said to us, it's a long way for you to come to Florida. I can make some phone calls to people in Philadelphia and get you somebody good. And I said, no, we're coming to West Palm Beach to you. You're the only one I trust with my daughter.
Leading up to the procedure, Dr. Fischer was in constant contact with the family.
Dr. Fischer and I did use a telehealth appointment. It was really nice and convenient because I was still able to stay at home in Pennsylvania, and we were able to communicate without having any issues.
So for a second time, Dr. Fischer performed surgery on Becky. Another success, not only for the procedure, but for the experience.
The nursing staff at Palm Beach Children's Hospital were fabulous. Whenever Becky rang her call bell, they were there. They answered immediately, and within 5 minutes, they were in the room when we needed something. I was very impressed.
Becky's almost done with high school, and her experiences, along with her mother and Dr. Fischer, have impacted her in more ways than one.
I'm very excited to graduate, and I want to go into the medical field and hopefully become a pediatric surgeon.
Music to Dr. Fischer's ears.
It warms my heart. It just makes you feel great about what you're doing, and I just think she has an incredibly talented life ahead of her.